My constituents in Delta were shocked this weekend. Accidents happen, people get injured, and when they do, they expect their local emergency department to be open. But this past weekend in my community of Delta, you could not do that. For 2 whole nights, the ER was closed, and when seconds matter, told my constituents to drive half an hour or more to Surrey Memorial, where wait times are up to 18 hours long. Mr. Speaker, to the Minister of Health, after 8 years of NDP governance, how can you accept this abject failure to deliver emergency health care in the province of BC?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you to the member for the question. And I want to start by saying I share his very deep concern for what had to take place this weekend in his constituency and for the people who live in his riding and the surrounding area. Everybody wants to be able to depend on the emergency department, knowing that it is there for them when they need emergency care. These decisions are not taken lightly, and Fraser Health and other health authorities facing this situation do everything that they can to ensure that there is sufficient staffing in an emergency department because it is so critical. Mr. Speaker, we are doing so much work to attract physicians, nurses, healthcare workers, everybody that we need to run every aspect of our public healthcare system here in British Columbia. When these very difficult decisions need to be taken, they are done in a way to help protect people by ensuring that the BC Emergency Health Services knows what's happening, that the public is alerted at a time so that they understand what is happening. But, Mr. Speaker, we have so much work to continue to do, attracting new physicians, credentialing internationally trained graduates, bringing in new nurses, and we're going to continue doing this work so that we can end these types of diversions. Thank you.
Delta South supplemental.
Thank you, Mr. Speaker. Mr. Speaker, for 8 years in this seat in the legislature, I have heard the same responses over and over and over again. Mr. Speaker, the emergency room is supposed to be a 24/7 service, yet under this NDP government, you can't guarantee the ER will be open when you need it. Think of the sounds and sirens at night around Ladner and Tawasin and wondering where that poor heart attack or stroke victim will be transported to and how long it will take. Or will they die on the way in an ambulance? Again, Mr. Speaker, to the Minister of Health, when will you fix your government's failure to ensure BC's emergency rooms are open when trauma strikes?
Through the chair member. Minister of Health.
Thank you, Honourable Speaker, and thank you again to the member for the follow-up question there. Again, there is so much work to do to build out the healthcare workers that we need to ensure that every aspect of our healthcare system is functioning in the way that British Columbians need and depend on. We have so much to be proud of here in our public healthcare system, and I know that the doctors and the nurses and the workers in those hospitals are feeling this, and they too are impacted by this. They are working so hard. Mr. Speaker, we didn't get into this problem.
Members.
We did not get into this problem overnight. Mr. Speaker, that's why we are taking short-term steps through the work that we're doing to attract more physicians, nurses, and healthcare workers, but longer-term steps too, like building a new medical school in Surrey through SFU. Mr. Speaker, when the opposition leader was in government, he had the opportunity to open a new Surrey medical school, and he said no. So, Mr. Speaker, we're going to continue to take every step that we can, every tool that we have in our tool belt to build our healthcare workforce in a time of a global shortage so that we can end these closures. Thank you.